Welcome to On the Couch, the podcast where real conversations meet real change. Pull up a seat, get comfortable, and join us as we dive deep into the conversations that matter most to Black and Brown communities. Hosted by Dr. Diamond and an incredible lineup of co-hosts, On the Couch brings you raw, insightful, and empowering discussions, from mental health and wellness to entrepreneurship, life insurance, healthcare, and everything in between. Our mission is simple: to educate, uplift, and create space for conversations that need to be heard. Whether you're here for practical advice, motivation, or just a dose of inspiration, you've come to the right place. So sit back, relax, and let's talk about the things that shape our lives, our futures, and our communities. This is On the Couch, where we keep it real, keep it relevant, and keep it moving. Let's get started.
Good morning, everyone. I'm Dr. Diamond, along with my co-hosts. We are going to get ready for On the Couch. So again, welcome to On the Couch. And today's topic is uncovering truths, sickle cell awareness and health equities. We'll be talking to Douglas Curry, so he'll be joining us shortly. But before he joins us, of course, I'm going to bring on my fabulous co-host so we can chat it up a little bit about the climate that's going on today in a political realm. And, and overall, what we'll be talking about is health. So I'll be bringing them on without further ado. I got Mark Lee waiting in the wings and Toya waiting in the wings. Good morning, you two. How's everything going?
Good morning.
Everything's going well over here. We got all kinds of activities going on here in Durham, North Carolina on a sunny day. So I'm actually at the Cultural Arts Center, as I often am when I'm doing this show with you, and all along those lines, you two ladies, and all in that space. But we've got a dance academy that is regularly doing stuff. So they teach folks dancing and drumming. So they've got a group of kids coming in here. And then we've got the jazz band downstairs. And there's just like festivals galore. I was on the mass transit earlier today, and I saw that there was a gospel festival in my neighborhood that'll be going on this afternoon. We've got our street festival going on, and there's even some activities going on by the ballpark. So it seems like there's just a lot of people that are out there enjoying this lovely weather. So there's definitely it might be fall on the calendar, but it feels almost summer-like. So a lot of people are out there enjoying the in the weather and enjoying the festivities, whether it's music, whether it's food, whether it's art, whether it's whatever. But there's a lot of things going on in this particular town on this particular day. As a matter of fact, there was, speaking of health fair, the church that's just down from me, St. Mark's, they're having a health screening today. So I did see that. I think they were doing prostate cancer. I think they were doing tests for colon, breast cancer, and a number of other health screenings that was going on. So they were organizing that as I was coming up here, because they're about maybe a block from this particular location where I'm at. But yeah, there was even a health screening that was going on today. So your topic fits in with what's going on here in town.
That's great. The health is important. We constantly have to talk about it and educate our community, because there are times that many of us don't keep up with our health because we need to. I know that I do. I make sure that every year I'm going to follow up with what I need to, supposed to my physical, you got to get your eyes exam, and then anything else that you need to be taken care of for yourself. Please make sure you go out and do it, because you know what? We only get one life here. It's not like we put a coin in and then we come right back. It doesn't work that way. So take care of your body, take care of your mind. If you feel your mind is not what it normally is, I'm talking about being sharp with your memory. Those are clues to maybe go check it out with your primary doctor, because you have concerns. You got to say something. You can't just walk around and say I'm fine, drink a glass of water and the water's going to fix it. No, that it doesn't work that way. And I know our community has a big mistrust for the health world, but we have to get in there and take care of ourselves and look for a doctor that we need, that we can build relationships with throughout the year. I can tell you, I have a great doctor. He listens very well. He doesn't play any games when it comes to health. You can bring him an issue and he's on it. And that's what we all need, build a relationship with your doctors. I know sometimes it's frustrating if you're going in and it's 15 minutes and you're like, 15 minutes? No, talk to your doctor, ask them questions if you're concerned about something. I mean, that's what I think, you all. But what do you think from your perspective on what suggestions we should have for our community for health?
Yes, I agree. As you know, I am a health warrior. I don't look like what I've been through. But one of the things that I had to accept is after my accident, in order for me to rehab, I had to do certain things. And sometimes we don't want to listen to what the prescription is, physical therapy, what have you. But one of the things that I have known just living through that is once I accepted my assignment, follow what the doctor prescribed, then that's when everything worked out. So on average, I probably go to the doctor 1 to 2 days a week. And I try to say to the folks that now I've been giving advice to people working in the social service field. As we know, there's metabolic syndrome. There are people who are pre-diabetic. You have cholesterol issues. One of the things that I learned with all of that is when you have a weekend of eating and you go and you get your blood work and you went to a cookout and there's mac and cheese, fried chicken and everything like that.
Yeah.
You can't do that. Because what happens is that particular blood work is a snapshot of what you've done. So I went, my cholesterol was high. I said, all I did was go for a weekend to have fried chicken, mac and cheese. And that's in my blood work history now.
Yeah.
And I'm like, what? So then the lady said, well, if you drink water, that's from the day before. So then that was one of the things that was a wake up for me. I said, I'm not accepting that. But then that made me have to take more medication. I said, you know what? I had to be honest. I went somewhere over the weekend. I was with my folks, people of color, and these are the things that we ate. So she said, you know what? That could have been a snapshot of what you ate. Let's try it again. So then what I had to do is go and do the blood work again. But out of being lazy, I just went because I had a doctor's appointment. I would no longer do that again. So the only thing is that here on the couch, we're going to give you information. And sometimes we are giving advice and we don't follow it. So I'm going to say right now, that was something that I did not follow. And then after that, I will never do that again. Just simple things as far as water and diluting everything that you're actually drinking and everything for the day. Just make sure the water is essential, very essential. So that means that if I eat something that's high in salt and if I don't drink any water, it's going to look like my sodium level was high. So these are things that we don't understand, but water is the natural element that's there that we're supposed to do, the 64 ounces of water. Do we drink 64 ounces a day, 8 glasses? I know I don't do it all the time because I take a water pill. So now you understand where there's a contradiction. So that means that my levels are going to be off. So we're just, we're talking about certain things that we need to check ourselves in the mirror. And I know I needed to check myself with that bad reading. So I don't want that anymore.
So you know what happens when you indulge. You hear, right, Mark? You indulge. Look what happens.
You indulge, you get in trouble and everything like that. But yeah, I agree. Water is essential. This is about my 3rd bottle all today and everything like that. So definitely water is very much an essential part of our daily intake. Any good doctor will tell you that and everything along that. It helps with the digestive process. It helps with a lot of other things that are part of our body and all along those lines. And I agree, got to make sure that you go on those regular doctor appointments, but also that you're attending to the specialty doctors, whether that's the eye doctor or whether that's the dentist or whether that's a number of other folks as well, because definitely you got to make sure that you keep that health in tip-top shape as much as possible. And of course, exercise is very important, whether that's a walk or whether that's going out for a run or bicycling or even my dad is very adamant in his exercise, and he's had some health concerns even in his age at 85 and everything, but he still goes out in terms of swimming, and even after his recent health scare, his doing PT, physical therapy, and all along those lines. So definitely you got to keep those health regimens going and all along those lines, no matter what your age is, because definitely it keeps us refreshed and everything like that. And we forget one that is very important, and I know you ladies can sometimes get caught up in it as well. But the important part of health that we oftentimes let slipped by, and I know that even a couple of times this week I've had a choppy version of what I'm going to describe. But because we are busy people, and because we've got all kinds of stress sometimes in our life, we got to make sure that we get an adequate amount of sleep. But sometimes you can
Yes.
have those choppy sleep. So I'm sure that you two ladies have probably woken up in the middle of the night for whatever reasons and everything like that, and then it kind of like messes the continuity of the sleep pattern and everything like that.
Yes, yes. I listen, I can speak on that. Waking up 2 o'clock in the morning, 3:30 in the morning. It's like, why? But we all go through these periods of changes that we go through, especially women. I'm pretty sure a lot of women that are over the age of 50 have, understand the hot flashes and the perimenopause and the menopause and all that you go through. It does a whole lot to your body. You can't sleep the way you want to. So that is, pretty heavy. So yeah, what I will say is, again, follow up with your doctors, find different regimens that you can use. But you're exactly right. When you don't have constant sleep, it is very difficult to like really regulate yourself. It's very hard to do. So and then when you get up the next day, you could be so exhausted because you haven't gotten enough sleep. And that's men and women. When you don't get enough sleep, you can't operate like you want to. So it is you're right, Mark. It's very crucial that we get in enough sleep. So what we do know scientifically, what they said, 8 hours of sleep, 7 to 8 hours of sleep. So if you can get that in, please get that in, because you'll feel refreshed the next day. You'll even have a burst of energy, to be honest, when you get enough sleep. You get that energy, you're ready to go, you're ready to conquer some things, whatever it is. You go out and do these things. So I'm wondering, did you hear, Mark, about the JFK or Kennedy? I don't know what his name is, but anyway, Kennedy's changing the regimen for children instead of them having the combination. Did you hear about the vaccinations that he's doing now, which is very detrimental to the children? This can cause a lot more death among children. What have you heard?
I've heard that RFK, well, one, I think that RFK Jr. is maybe got some, we talk about health, but there's different types of health. There is your physical health, your emotional health, and your mental health. And I'm not 100% sure that his mental health is all together there, because some of the things that he says, I sometimes wonder about, and all along those lines, because I did hear some of the things. I forgot the exact nature of what he was talking about, but definitely he wanted to change some of these things with the vaccination for the kids, because he's got a concern about the vaccination and its connection to autism, even though most doctors and most people in that research field are not finding that connection the way that he's finding it. So that's something in his head, not in the reality and everything. But I'll tell you the other thing that I heard that was very scary. And like I said, I've got family members that are involved in this. It sounds like you do as well. And I think our other hosts do also, a couple of them, other hosts that we've had in the past. But he's talking about impacting organ donations. And we don't know that organ donations is a big part of our uh,
Yes.
community and everything like that. But he's got some things that he wants to do to actually make it not easier, but harder for organ donations and all along those lines. So, yeah, some of the things that RFK is doing, and like I said, I've got my brother's significant other has got a new heart, and we are so glad that she's been able to survive with that for now a number of years. But he's now done significant reforms to the U.S. organ transplant system, including the decertification of a major organ procurement agent organization due to safety concerns. So he's got some safety concerns, but because of that, he's going to kind of like cut back on some of these things and decertify one of these agencies. So he's announcing a historic crackdown on broken organ donation system. So he's saying that the organ donation system is broken. And I'm not saying that it can't have some improvements. We know that any agency and any organization can have some improvements, but I am concerned that if some of these things are done haphazardly, that could impact some folks that might need a new kidney, a new heart, a new liver, and a number of other organs that can be transplanted. I mean, you can even have your eyes transplanted and a number of other things transplanted as well. So I do know people that have gone through these various transplants and are living with their new organs and everything like that. So that is something that is of concern to me.
I agree with that concern. Overall, health wise, the coming in to an office such as that one, that is a big weight to carry, because you're making decisions about every human being that is walking around in the United States. When you make the worst decisions for people, you're giving them a death sentence for no apparent reason.
Right.
Now, when you're making it difficult for organ donations, that means it is an ulterior motive behind that. I believe it is certain communities that are being targeted, that they don't deserve the donated heart or lungs or liver, whatever it is. They're trying to prevent other cultures from getting it. But what they don't understand is, we as Black people, our body is so made up so differently than theirs, but you're so quick to say or block us out of things. So it almost makes me feel like when we have to go back to their philosophy of separate but equal, which means that maybe we need our own hospitals. We need, again, our own elementary schools. It's going to be down to that, because these people have no regards for no one else that don't look like them. And it's about blocking people out. I was watching this gentleman on, should I even say gentleman? It was a guy on Facebook, white guy on Facebook, and he says, I don't know what it is about people of color. Why do they care if we have our own communities? Sir, what are you talking about? We had our own communities and y'all destroyed them. But see, they're so dense with not paying attention to what is around them or what history is. And this is why history should be taught, especially ours. And they don't understand the history at all, because they just safely assume that, oh, we want them not to have their own community. Go for it. Go for your own community. But remember, when our communities are thriving, don't come into our communities destroying it because you think you can, and it's a shame that this philosophy of thinking that, well, if we're separate, we won't have any more crimes and different things like that. It was some so-called pastor. I saw him on Facebook saying that teach your children to stay away from Black children and Black people. I was like, who says these things? And you're supposed to be a Christian? This is the climate that we're living in. And then you have Kennedy, who's willing to put children to their early deaths, messing with vaccines. There's no scientific basis, like you said, Mark, for anything that he's doing. He's just doing it based on what is in his head. And then he has his cronies believing what he's saying, and then they're going with it. And they signing these things into law is what scares me. They're really agreeing with him and signing this stuff into law. How? What scientific basis do you have if you bring a physician in front of you and they're telling you what you're saying has no merit, but they're arguing with the doctor who went to school for the exact thing, which is about diseases? So how do you argue with the person who went to school? I don't get it. Maybe I'm missing something.
Yeah, I don't get it either and everything like that. But yeah, you just got people doing interesting things in that regards, and they're doing some things that don't make any sense whatsoever. And you were so right about the history, because I know that even here in Durham, North Carolina, it is now a clinic, but at one time we had Lincoln Hospital. That's actually where I was born, and I was talking to my dad a couple of days ago, and he was telling me that that's where he was born, because I was actually telling him that a friend of mine was looking at a building to put an art studio in, and he was like, I think that's this place that my attending physician had his office at and everything like that. So he had both his doctor's office as well as the hospital office and everything. But that was a time that we had segregated hospitals, and there was a lot of those even up there where you ladies are in the New Jersey, New York area, and all along those lines. And we're even seeing people doing some very innovative things. I just saw something earlier today because I ran into a gentleman that's going to be doing music education, and he's going to be doing a music education event later on this evening and everything at a bar and everything. But then I was researching him, I found out that they've got this group here called Night School Bar. So it's actually literally in a bar but they're offering various intense night school courses and everything because they've got classes in creative writing, literature, anthropology, political economy, environmental and medical humanities, feminist and anti-racist philosophy, and interdisciplinary studies. So it was good to see that even though it was founded by this white lady and everything, she does have quite a few teachers because these teachers are actually getting paid for offering these courses, and they're both online as well as in person and everything like that. So you've got some people, partially because of the pandemic that we just came out of, or supposedly are out of, even though there are still regular cases of the coronavirus that are out there and everything like that, that started doing innovative education. And this was an example of innovative education. And they were doing fundraisers and continue to do fundraisers because I think they would like to continue past the year 2025.
Mm. So, Toy, I know you were having some difficulties back then. You came
like,
back.
what's going on with? Yes, I had to reset. It's about my devices is not working. I said, you know what? It's okay. So I changed to my hotspot because I'm at my godmommy's house because 75 years. 75 years of life. And I said, I got to work it out to do everything.
Yes.
So I said, a straight blessing. I said, my German godmother, Mark.
All
I
right.
said, strong. Yes. So I'm at her house today. I'm on location. And that's how we have to make sure that we multitask. And I had to make sure that I'm here. Exactly. I didn't learn it right. I said, I'm on assignment, but how am I going to do everything? As you know, I tell you, I'm the multitasker.
Right.
I can multitask. That's what you call management of different things. And I just need to add on after my name because I'm always multitasking. I love my schedule. And sometimes we get overwhelmed and we give this advice. But now I said, everything that we do has to be intentional. And sometimes I didn't get it. I think that we people please because we're trying to do everything. But you know what? As we learn with life, it can't be one-sided. I got to water who waters me. And that's what I'm doing. She waters me and I don't tell her no. She don't tell me no. So now I'm here making sure that I'm able to do this the show and make sure that we talk to our Black and brown community about what works. And as you know, we are following the advice that we give. So sometimes when you sit on our couch, we're telling you it because we're living it. And that's what happened today. We are able to will, there's a way. What the old folks used to say, there's a will, there's a way.
Well, there's the way there's a will, and not only that, but you just reminded me there was a one of our community warriors here in this area. She passed away a few years ago, and everything passed away at 100 plus. I think she was 102, but I won't say that she was driving well. I think she was driving well into her 90s and all along those lines and everything like that. And then later on in her life, she had some people from her church that were helping get her around with that, was getting her to the grocery store, getting that to her beauty appointment. Because, one of the things that we oftentimes forget in our health journeys is the need to pamper ourselves and all along those lines. And that is part of the health journey, making sure that you've got the right foods, that you are eating healthy and all along those lines. I mean, as I put it, my aunt actually, she's been dropping off some care packages every once in a while for me from some different churches that she's gone to, and they are offering food and everything like that. So she's dropped off some food care packages for me, and a couple of the care packages, you'll love this, they are not exactly all healthy. Like I said, she's definitely brought some zucchini, she's brought some cereals, she's brought some squash and cucumbers and a number of other things, milk and juices and other things that are very much healthy for you. But I would be lying if I said that there weren't some cakes in there and all along those lines. And when I told my mom that, she was like, that's food for the soul. So like I said, that's the way she described it. Is that sometimes we have to have things that may not be good for us in the sense of healthy, but they might be something that can perk up the spirit.
Yes, definitely. And I like how you said care package. And see, that's where I'm Southern, I say raised. And that's the thing where sometimes I had to learn that my lens, I have to go into the appropriate area. And that's something that my family does. Like I said, it's sharecroppers, food and healthy things, some bad things. Because like with the pig, I was talking to someone the other day and they said, well, back then they gave us the pig because nobody wanted to eat the pig. But what we've learned with our traditions of eating, when you have New Year's, you have the black eyed peas, right? You have the greens, the cornbread, and the pork. The pork portion was for sustaining. Everything in that swine can be eaten from the rooter to the tutor. And as I think back, I said, I ate all that stuff, not knowing what all that is, but that's what they gave us. And if you look at the pig, that's why we were powerful, because we were given those things. We were able to sustain in the croppers, picking cotton and things like that. So, however, when I think about that tradition, I don't eat as much pork because I can't do it health wise, but that's the tradition. And when they say soul food, you're cooking with love. And I know that in days when I'm not feeling good, my stuff don't come out as right. And you think about, I forgot one of the movies. I know, of course, we know soul food, but it was one of the movies, I think it was Danny Glover in there. And I remember he was cooking something. I can't think of the movie. And he cooked the pie. But when the daughter came in, she said, Mama cooked it with love. So you kind of get where we're going. Soul food, when you're cooking it correctly, making your cornbread, your homemade meals, the recipes were built on love. So I just wanted to put that out there. So now when you got your care package, Mark, that was something for love. You can look through it. I've learned. I'm not going to turn my nose up. Thank you so much for thinking of me. I'm going to take out the stuff that I want and I'm going to pass it on to someone else. And that's a tradition of people of color. You know, you take something, a meal, and you can feed the masses. Thinking about the 2 fish and 5 loaves, and in a biblical sense, we fed each other. When you went to someone's house, you sat down and you shared. Now we don't do that. And it seems to me, why are we acting like we don't have a lot? Because the grand architect stretched those meals. And, you know, I don't mean to be all sentimental now, but I just think about my big mama.
I think you're right, though. We're going to return to that, though. I think we're going to be forced to join as a community or communities, where it's going to be all of us that identify as the other. Okay. This is going to be very important. So anyone that's listening to us right now, and come back and listen to us later on. And I want to thank those that do come back and listen to us later on. We have some big numbers, you know, when they come back. So thank you all for that. But it's important that we recognize when that time comes to join forces, because we are going to need to take care of each other by eating healthy, making maybe big meals where you're feeding your next door neighbor who is a senior person or someone that might be disabled. You may even just say, you know what, tonight I'm going to invite this family over because they may not have something, or maybe they do and you just want to invite them over anyway. I think it's just important now that we have to rebuild our communities, and it's going to happen. We're going to be forced to do that because of the climate that we're in right now. You know, prior to you getting on, Mark and I was just talking about, just again, you have what's his name, RFK and Kennedy, you know, what he's doing with the vaccinations and the children. I feel that our children are not considered because it's the decision that he's making based off of his own theories, and he's not even going through scientific research. And that is why you have doctors who does scientific research, from MDs to PhDs. These people are sitting there. These are doctors that do ongoing research, and they're sitting there taking specimens and looking at them and drawing conclusion. What works, what doesn't work? What scientific facts do they have? But none. But then when these doctors are sitting in front of them in Congress, they're arguing with them like they don't know what they're talking about, yet they've been in school for years. And they research and they specialize and they have their expertise in these areas. So if a person is telling you measles, mumps, and rubella, the shot is important for children, listen to that. Why are you trying to separate the actual vaccination for the children and still not recognizing that you're putting children in harm's way? When he took over, I know both of you probably heard this throughout the news or whatever you listen to. There were multiple children that died from the measles and the mumps early on when he took office, because people began to believe it. And I need people to stop believing it. And I'm talking about Black and white alike. Stop listening to something that don't have scientific basis. You are going to harm yourself and others. And with our conversation today about self-care, this is what we're talking about. Proper decisions for yourself and your family. If you're not making them, then what? You're going to be in some hot water. What are you going to do? People start dropping off like flies because you're listening to these people, and I'm sorry, and I feel bad for the physicians because they are scared for our communities. They really don't know what to do.
Right.
I don't know if you all have been hearing their concerns.
Oh yeah,
Well, of
they're
course.
definitely concerned and all along those lines. Dr. Diamond, I don't know if you've been hearing this, and definitely go ahead as well. But there's even diseases that we thought that had been eradicated that are now making a return and everything like that. So tuberculosis, folks thought that they were not gone and it had been gone forever. Whooping cough, people thought that that was gone, and a number of other ones that are making a vicious return, and they are definitely impacting people because they thought that they had gotten rid of it totally, but because of some of the bad medical decisions that have been made, they are coming back with a force in some cases.
Yes, and it's germ warfare, and I'm gonna be honest because I like sci-fi. Because I always think, and it's out, every now and then I might talk about the Terminator. I just know that some of the technology, I don't know how we got it, but our grand architect understands what our existence is. And I'm just gonna think about. I loved when I was in my nursing program, microbiology, one of my favorite classes. And it's basically you have your little petri dish. Everything there, you come up with a hypothesis. The hypothesis is what you're gonna test. But how can you do an adequate sample if you're not using our folks? So all I know is that I took this COVID vaccine. I took the Johnson & Johnson. Was forced to do that. Since then, my whole chemical makeup changed. But when you have a job and you're forced, I know that I have medical records that show I didn't have any problems with my certain systems. But after that, I'm not the same person. So only thing I just with prayer, I'm looking at things. I take the small W's. But what about those vaccines that's going to help someone? Because now you're not taking it. As you know, with autism or just any of the spectrum disorders, we don't know what it is. All I know is that when you think about your chemical makeup, you have your chromosomes and things of that nature. If we have germ warfare, as Mark just said, all these particular diseases are coming back. Why? So now all we know is that I remember that movie Virus. And I remember now I constantly have a little pump in my car. I clean my hands constantly. That is a must. When I come, I don't take my hands and touch the mucal, my eyes, my nose, and my mouth. The common cold, once it becomes moistened, it will do. So you have to teach the children and everyone, please use your universal precautions. Use them. I thought I had COVID not too long ago because we were at a conference. I went to the doctor, had a test. He said, oh, no, you just have a cold. He said, why do folks feel you just can't get a cold? I was sick, took the Mucinex, asthmatic. I got through it, but I thought was something wrong. Took the COVID vaccine. Swab. It was negative because that's what it was. But we forget that the regular things that were here can still occur. We're worrying about that, but that's a distraction for us. So, ladies and gentlemen, listening, universal precautions is washing your hands. Your little children, make sure that you have those antibacterial wipes in your diaper bags. Because what happens is the kids are doing that. They're back in school right now. So what happened, those germs are brought home. I work from home most of the time. But then I do go to the office, but I make sure that I wash my hands. It's the simplest thing, washing your hands.
Wash your hands.
Everything, rinse. Those are the things that bother us, that we don't pay attention. So now if you do that, when the children come in, I have antibacterial pumps at the front door, at the back door, by the garage. These are little things that have become a way of life. Sorry to beat you with a dead horse, but now that we know it is cold and flu season, that's it.
Yes, I agree with you. Please take precautions. Even when you're going out and using the public restrooms, I usually, especially when I go on a trip, I would like to say this to anyone that are on road trips and you have, and they're, female and little girls going with you, please make sure you bring Clorox wipes with you. Wipe those seats off thoroughly, because again, you want to keep the germs down. Remember, our skin have pores. If you sit on just anything, you don't know what you're pulling back up into your pores. Remember, our skin breathes just like we do. As our lungs are taking in breath and then expelling the breath, breath, remember our pores is getting it as well. So be careful and wipe behind yourself all the time. I was talking about those porta potties. I can't stand porta potties. I think they're a petri dish, but just in a bigger version. I have to be desperate to use one of those because it is just so nasty to me. I've only seen 2 porta potties where they were actually big in the inside. They looked like real bathrooms. They had the sink in there. The water was hot. It was clean. It smelled good. Those are porta potties to me. I would use those, but those little small ones, I can't stand them. And when you have hundreds and thousands of people in a park somewhere, it's just, oh my gosh. I just, you know, you don't want to hold it, but then you feel like you have to because it's just disgusting. But whatever you do, if you have to use it, same thing. Carry your Clorox wipes with you, a mask with you, yes, a mask, and also toilet paper, because they tend to run out of toilet paper. Always be prepared wherever you go. I do that religiously, especially when I'm with my granddaughter. I make sure I have, like you said, hand sanitizer. When we're going places, I make sure I wipe the seat off for her before she even touches the seat. I'm like, do not touch it. Keep your legs crossed. If you got to urinate so bad, I said, keep your legs crossed and just hold on until I wipe it, and then she's good to go. And she knows now to ask. So I'm saying to you all, please make sure that you use every precaution there is. Now, as we're waiting for Doug, and I know, again, he's doing something very vital today, too. So if we don't get him, we will get him another day. But we're going to keep talking about health. Now, I do have a round table talk question. So what does healing justice look like in the context of healthcare for Black Americans? What do you think? What does healing justice look like?
Well, I mean,
That
part
we're
of
gonna
it. Go ahead.
Either one.
I was just going to say healing justice means that whenever it comes to my healthcare, I can have access to everything. Because what I've noticed is there's some disparities, if that's what I'm hearing. Maybe I'm a little loaded with that because I know what justice is. When I apply for something, I have medications that work for me. Now you're saying that medication is not approved. It's been working. So now is it that I'm not going to enough doctor's appointments? Now you're going to take the medication from me. Now I got to come back to your doctors. That doesn't make sense to me. I want justice in that. If it's working for me, why all of a sudden now, after 2 years, it's not approved? That doesn't make sense. So I don't have no justice because why break something that's not broken? Yeah. You know, I don't understand that. Then the other thing is that when you're saying like now the insurance premiums come up, then they say, oh, you're an outlier. So now if the organization has been keeping these folks, now you're going up on the premium. I feel there's no justice. Now you have Obamacare. One of the things now, as me helping folks out and what I do, if you don't have insurance now, they tax you on your taxes. Do people know that? That if you have to have a 1095 form, and when your tax preparer does the taxes, you have to have proof of insurance. Now, if you don't have insurance, they're going to ask you for an Obama phone. Well, I'm going to say Obamacare, which is universal health care in the country. So that means that, to me, that's injustice. Because I don't have insurance, now you're going to charge me more on my taxes. Does that make sense to you? And I'm just telling you, I don't know if folks don't know that you have to have insurance. If you don't have it, they will tax you. To me, that's injustice. That may mean that I can't afford the premium on my job. So now I'm going to get double taxed again. So that's what I'm talking about. I'm sorry. I don't know if that's what you mean. I want to have justice that as an American, that I work on the job, the insurance should be appropriate. It's going to cover everything that I have. Why do I have a high deductible plan? Because my employer is not. So you see how this is an oxymoron? It's a contradiction. That does not make sense. So my meaning is it's justice. In Canada, they have universal health care. As much as we pay here, that's all I'm saying.
Yep, we should have it as well. And definitely, as y'all were just alluding to, it's been a lot of talk about what they're going to do in terms of the shutdown of the government. And one of the things that they're talking about doing is rolling back Obamacare, which would then mean a lot of people would lose the insurance that they were able to get over these last several years and everything like that. And now they're talking about replacing it with some sort of other kind of care. But until we know what that is, you know, you want what you've already got versus what you might get in theory. And, theory is only that, it's just theory and everything like that. And we don't know that it would be a better care, even though that's what they're trying to present, even though I don't buy that and everything. And the other thing when it comes to justice is that, and I think one of you ladies alluded to it earlier, the bodies are built differently. There are definitely different styles and everything like that. And
Right.
our physicians need to be aware of that. If they are doing tests, they need to be, and they're testing in our community, they need to be testing for sickle cell, because we know that that is more prevalent in our community. They need to be testing probably even more prevalently in our community, hypertension, because of some of our diet habits and all along those lines and everything like that. So they need to be aware if they are a medical practitioner anywhere in our community, be it black or brown, the kind of things that are impacting us. And they also need to understand, and you kind of alluded to it, Dr. Diamond, earlier,
Mhm.
the reason that we are fearful of doctors to some degree is because of the history, whether that's the Tuskegee Airmen, whether that's some of the Spanish women that were tested at the time that they were pregnant and all along those lines. So there has been some history that is out there that is the reason that people are apprehensive, and they need to understand that when they go into our community, so that they can make people feel at comfort and that they are not part of the problem, they're actually part of the solution.
Amen. So here's my answer to the healing justice. Okay. Black women mortality rate when it comes to pregnancy. There is an injustice there. I am a person who knows for a fact that there is injustice there, because that's what my mom actually died from. Not being taken care of well, to the point where she lost her life and my siblings' life as well. So it is a true issue. One of my friends, she is a real advocate for this as well. And she's out there in the front lines. I'm hoping to bring her on our show too, because she will be great on the show. We have been longtime friends. I call her my little sister, but she definitely is an advocate for maternal mortality rate. It is very important that mothers have to go in and start really demanding that they get proper service. If I'm telling you I'm in pain, believe it. Stop assuming that this Black woman or any other person that don't look like you is lying, or we can take pain versus our counterparts. No such thing, because there are Black women that can't tolerate pain at all. But if a person is telling you something is wrong and they're telling you that they don't feel well, why don't you just believe them? Why do you have to go to 50 different hospitals for someone to believe you? No one should have to go through that at all. You are putting lives in jeopardy, not one life, but multiple lives. So it depends on how many children this mother is carrying. She can have one embryo or one baby to 3 babies she can be carrying. So are you willing to sacrifice her life as well as her baby's life, or baby's life, because you're thinking that she's not telling you the truth? I think, things just have to be really looked at when it comes to the Black community. The ongoing goal that this society have is destroying us. It hasn't worked. Why do you keep doing it? I don't understand what your end result is going to be. You cannot eliminate the people who started civilization. So let's stop right there. Start getting your mind around the fact that you can't destroy God's children. Quit it, because it's not working for you. So why don't you just join forces with us and make sure we're all living as human beings and be done with it, and stop judging based on what you think you see. Stop putting these women at risk, because you are harming them. So please stop. If you're in the world of medical, please, if the woman don't look like you, believe what she's saying. Even if it is a Black woman that's coming in there and saying that she has abdominal pain, believe her. She may have a cyst. She may have endometriosis. You don't know what she has. Why don't you just find out what's going on? Why is it that people have to keep going back? So I feel that is an injustice. I was watching a young lady this morning on TikTok, and You don't hear her talking, but you read the caption, and it was about her baby. She went in because her baby kept throwing up and crying all night long. This baby was not getting to sleep, nor did she. She kept going back and forth to the hospital. Do you know that baby had meningitis?
Wow.
Wow.
Because they didn't want to believe her. They kept on saying, he's okay, he's okay. How do you know? And guess what? They never tested him until she got fed up and started telling them, look, my child needs to be tested, and we're not leaving. And, you know, I suggest that to a lot of people too. Anyone that's listening to us, please do not leave that hospital if you are not feeling well. Because God forbid you go home and you will never wake up, depending on what is going on with you. Push and ask for your the health care that you need. The other thing that people are doing here in the medical world, and I'm just going to call it for what it is, if they see your insurance is affordable health care, and I have, let's say, my work insurance, they're going to treat me better than the person that have ACA. Why does it make a difference? This is a person's life. So that's another injustice that I see. People need to stop doing that because, again, you're being judgmental. How do you know that's not an attorney sitting in front of you or another doctor sitting in front of you? Just because they have affordable health care, it could be that they're struggling and they still have their profession, but they're struggling. So they have to go and get state insurance. These things happen. It's reality.
And I'm gonna piggyback on it if I may, because you know, I'm gonna tell you this. I broke my knee. Let me just tell you this. I had Victor Cruz, Tony Park, I had their interviews in one. And I had the insurance. All I know is my knee was out, coming through my skin. They sent me home like that. I had to drag my foot out of there. I couldn't get on the wheelchair. I'm looking at this. They tell me, you got to go to the orthopedic. I called someone. I said, what do I do? They would not service me in 2017. Okay? They said, oh, you got to go to a doctor. Oh, you had a fall. I can't help you. I had to call someone. I had to call a lawyer to help me. Then I had to sit for almost like that in this old flimsy little thing. So the point of the matter is I went through that health inequity. Let's say inequity. So now when I say I'm an advocate, and I'm glad that you hit those points, because I'm going to be honest with you, I've experienced that. You've experienced that, but they look at us and not understand. I should have had a grandbaby born. And it took me a while, and I'm glad you said that. I can say that because I am not done with this. Where there was a person who's younger parent, and I'm RH negative, and I had to hear something, and she said, I got to get a Rogam shot. You know why I know that? Because I had miscarriages. Okay? Did not know what it was. Most women don't even know if you're RH negative. So I said, young lady, you need to have this. When you are RH negative and you're pregnant, at the 4th month of pregnancy, you need a Rogam injection after the baby is born. So what happened is the baby wasn't there, and I have proof. Oh, he has a strong heartbeat and everything. So now, this is hard for me even to say, but that's inequity because of the type of insurance. So now I tell anyone listening, you need to know your blood type if you're doing prenatal health. Have them run it. So then when they say, oh, she took the blood, now if someone has a child here, you can't sue because they knew her blood type. They were only thing because of her insurance, they didn't want the baby to be born. That's it.
Right.
So if you are a woman that wants to carry a child, you need to run those things. If you are RH negative, Rogam, okay, you need that injection because if not, you're going to have a mortality. So then I spoke with the funeral home. They said, you know what, this is not the first time this has happened. Most of the babies that we pick up, same situation. So now we're just telling you. And I had to live. I was excited. But now I said, you know what, I'm an advocate. Because most of the time, as Dr. Diamond said, we don't look like what we've been through when it comes to pain. And I'm going to go back to me. My pain tolerance is different. When you've had so many surgeries, you can tolerate pain. People look at you. As you know, with controlled substances, I deal with that on the job as a quality assurance professional. What they do now is they don't want to give you those particular things. As Dr. Diamond said, you have to go to different hospitals to get the care because they look at a Black and brown person, they think we're drug seeking. Right. It's not drug seeking. They need the care. So that, again, you have to advocate. And then at that time, you know what? Let me speak to a supervisor. I am not feeling well. Just because I look like I'm Black and brown, I am not drug seeking. I am not an addict. I am legitimately having some pain here. So do you understand? And then from there, what happens is we have to deal with it, the pain. So that means that if they don't give us the drugs that are needed for pain, that means that we learn how to deal with it. That's what that means. There could be an underlying health issue that you have ignored. There could be internal bleeding. There is anemia, hemorrhaging. Only thing we know that we may bleed out. So the only thing today is what we talk about on the couch is real issues you advocate. And as here you see our information is less that we are connected to nurses, master level nurses, then we might need to help you with advocacy. We're going to carry every gamut of what needs to be addressed here. So now we have our comments. If you ever find anything here, shoot us a line. Because guess what? Because we work in that field, we know what it looks like. And you never want to feel that you are not heard because you do have a voice. And I'm so glad, Dr. Diamond, that you brought that up. Because right now, I know there was an individual that we both know. And she went to the hospital, had to get a second opinion. And when someone had to have emergency surgery, that means that that person wasn't heard. Yeah. So don't never be dismayed. If you feel in your gut that something is not right, as they say, you see something, say something. If you feel something, do something.
Do something. That's right. Do something. Go get the help that you need. Mark, you got something for us too?
Yeah, I just had a question for you along those same kind of lines and everything. I also know people that are in medical straits and medical situations and all along those lines. And sometimes, and I kind of alluded to it earlier, after you've had major surgeries and all along those lines, you get into a state of funk, a state of depression, and all along those lines. So what kind of advice would you give to folks that are in those kind of situations? Because I know a couple of people that have been in medical situations. I know some that have a very positive attitude about life and everything, and they are going full force ahead. But I know others that are starting to get in that medical funk, and sometimes that's where medical professionals, I know that the two of you ladies would find a way to get people out of that mental state of being and everything. But and I know there are hotlines like 988 and others, but you do have some people that have been through so many surgeries, kind of like what you went through, Toya, and everything, that they get through that state of depression and all along those lines. So what kind of advice would you give to folks? Because I have one friend that I think he's probably had about 15 to 20 surgeries at this point of his life, probably in his late 60s and everything like that. But what is advice would you give to particularly somebody that is
that's a loaded question. I had to will myself through there. I had to get back involved with church because at that point there was a period of depression that I didn't share. And when people ask you a question, how are you?
Right.
I thought they were really asking me a question. And when I answered them, all she does is talk about her health. I said, well, you asked me a question. So what I had to learn is that are people really trying to honestly ask, or they just want to know my business? But from to give you the advice is here is that there is going to be some ups and downs. My leg was straight for 4 months. I couldn't walk. I was in the geriatric realm where I had the pins and someone had to bathe me and everything. So imagine all of that. And my humility. And I just know that I looked at 4 walls. But from 17 to now, I just know I have not looked through what I've been through. And it gave me an understanding of now when I look at the geriatric or the older adult, they don't want to ask. And I think about my career providing services to the senior sinners. And now I had a different outlook of that. And now I see why they don't call you. Because when they call, everybody always say, I don't want to bother anyone. Then they're in their home, don't have food. Do you know that if you don't clean your house, that makes you more susceptible to pneumonia? I had a family member who pretty much died of pneumonia. He was a lung cancer survivor, throat cancer, preacher, had a microphone, and he passed for pneumonia. So that was something that I always reflected on. And I said, you know what misses is that sometimes people don't say that they need help. So if you need help, ask for it. But a person that's older will not. So just understand that you're going to have to get your care team together. People that you have, and I tell folks you have a calendar, the 7 days in a week. Who are you going to ask? You don't want to keep asking the same people. So what I had to do was get my care team. Can you take me to physical therapy? Can you do this? Then, of course, there's Uber. So then at that time, you might just want to give someone an Uber gift card or how you can help out. And it helped me to learn that, you know what, if I ask someone and they don't want to, it's okay. Because what happens is because we don't want to ask. Because at the end of the day, you have to get these things done. You have to get the therapy. You have to do this, or you're not going to have the mobility. So the only thing that I'm going to say here is you may get some no's. But at the end of the day, sometimes we are prideful as individuals, and maybe they don't want to say what's going on. And what you say is, you know what, it's okay. I understand.
Yep.
Versus no problem. Someone said to me, you're a little dismissive at times. It's not that I'm dismissive. When you constantly ask people that you know you thought loved you and you get the answers that you get, it's not that I'm dismissive. It's just that I didn't know how to respond. So now I just got to say, I understand. And I never thought about it. And I think that Jim in my life, they say that it's not angry. It's just that when you've gone through something, you have a different lens. So anybody that's listening, sometimes people don't want to tell you no because they may be going through something in their own life. So what you have to do is just give them some grace and understand that you have to set healthy boundaries. Because all I know is I live life because I treat people the way I want to be treated. And then what happens is that helps you with your humility. So thank you, Mark, for saying that. You have to get your team together. And if you get a no, it's okay. That maybe that person has a lot on their plate. But sometimes you got to take a step back and you have to listen to the room. So that's what I learned in this journey, is that sometimes you just got to say, okay, and move on, because there's always something. And I say that a lot. When I tell you, if God brings you to it, He's going to bring you through it. And sometimes that exposure is not bad. It's just that you have to make a decision for yourself when you go on this journey, because you don't want to always be the needy person and all of that. And just understand that, you know what, this is a journey that we're going through. And once you get your healthcare team in, and what it is not really quattro pro this for this, is that we're rewarding each other. And what I had to learn is that I had been giving myself and not getting anything back. So only thing here is that it should not be one-sided. So that's the one thing that I've learned. So that what I do is I don't give to receive. I just do that. I'm extending the olive branch. But what we have to do now is that we have to take our step back and look at a list. When you're doing an inventory of your life, the inventory is you're looking at what's in black and white. Take everything out of the emotions out of it. Look at the black and white. So that's what I can share for those when you're going through those things. You call who you know you can depend on. And sometimes it may not be a family member. It may be an extended friend who is family. As Dr. Diamond said, we got to learn to take care of each other. So what I do is, like, now I'm here. I always multitask to make sure that I put my hand back and don't forget. And I think sometimes when we're going through stuff ourselves, we forget about people who were there for us. And it's okay that you set boundaries. And I'm glad that you said that, because I'm on the other side now. I'm on the other side. I don't look through what I've been through. And I'm going to say that because I added it up, 23 surgeries. So looking at me today as a health topic, do I look like I've had 23 surgeries?
Right.
And I just said, so when you come to the butterfly room, you'll learn about that. Here is for information. History is our thing. We're going to dive in to address the things that folks don't want to talk about.
Yeah, that makes a lot of sense. Along those same lines and everything, Dr. Damage, just really quickly, and I'll make point of two of those things that you brought up that I think are important to address. Sometimes there are health issues that we don't think about and everything. Like I said, we're getting out of the summer months and everything, and on the network that I'm part of, that I now have this show trying to air regularly on as well and everything, which is Pod TV. There's a young lady that is into history. She has her own academy that is the St. C Academy. She actually lost one of her kids. I think it was a middle kid because of heat stroke and everything like that. So we also have to pay attention to the environmental health concerns as well. So she's been doing a lot of stuff around grieving and stuff like that. And I think she's going to come back actually this week, this Tuesday, because her show is on Tuesday, and come back and start doing her show regularly, because she said that gave her some peace of mind. So she thinks that this would help in her own therapy, getting back to something that she does regularly and that she enjoyed doing and everything along those lines. And the other thing, Toya, that you said that I think people need to be aware of is the environmental concerns that can exist in our own houses and everything like that. Asbestos is real, and people need to be aware of that. Mold and mildew are real, and they can have some health consequences as well. So definitely folks need to pay attention to some of the things that are environmental health concerns as well, because definitely they are things that are in our environment that can impact our health, and that could even be in our office environments, because I know that even here in this building there have been some environmental concerns that we're working to working to improve on and to correct so that it can stay healthy for another 50 years, because this building is over 100 years old. It was built in 1891 and everything like that. And in terms of a cultural arts center, it's been 50 years of it being a cultural center. So of course, in 50 years and the wear and tear of buildings, there can be health concerns and health issues as well. So definitely keep that in mind, whether it's your house, your apartment, or your office buildings as well.
You gotta look at the black here, because there's mold. I have a sense for mold. I remember I had an apartment I was renting, and the lady left her kids home, and it was mold in my house. I came in my apartment, it was raining in there. They're gonna tell me to move in there. I opened up the laundry closet, it was all this mold. They didn't even go in the closet. I said, I can't move here, because I kept going in my senses, because I have allergies, and I said, I can't stay here. I'm an asthmatic. So just imagine, as you said, you're in mold every day. You're coughing. You're going through these environmental triggers, and you're thinking you're okay, but the office building is killing you. It really is. So just pay attention to all those things. And if you wondering why you're sick, it could be something that you're constantly taking an antibiotic, which eventually your immune system gets worn down. So just look at those things. Just peek and see if you see black stuff and the smell. I know that with the environmental services, I don't know if it's something that you can purchase, but I remember the person who, a family member, worked for insurance restoration. He put something to the wall, and we had to let them know. They said, she can't move in here. It's still wet. Right. And they didn't know I had those things. They said, what do you mean? They said, no, this is not, this is inhabitable. So it was an interesting situation where it was a nice brand new apartment, but y'all didn't remediate it. You should have ripped down the sheetrock, took all that out, because it was mold inside there, lead paint. Some of the old houses have lead paint, which causes neurological issues. People don't understand that with the old homes. The only time you find out about that is when people don't want to pay their rent. Unfortunately, I've been in situations with someone, then they're going to contend the house. But as people don't realize, if you're the owner, you can't sue. And that was something that I learned. I said, wait a minute. They condemn these houses. But of course, for folks who have rental assistance and there's slumlords, there's a whole bunch that you have to look at. We do have rights. And sometimes these children, they say they have a behavioral issues. It could be lead. It could be a whole bunch of other things that's in that home that's causing those children to have behavioral issues.
I want to address the two things that Mark was talking about, because I know we're getting to the end of the show, but I do want to address, as he stated, about the state of mind of when you're in a state of depression, what do you do with that? And then also the grieving. So I want to couple those two together. So again, as a therapist that deals with individuals, families, it is very, in couples, it's very important that one, we identify what is bringing us to this state, you know. And how do you do that? Sometimes you can do it on your own by possibly journaling. Other times you may need to seek out some professional help. And if you can't afford to get the professional help, either try a group setting where it could be a local community where they have free services and you go there. But you have to dig within yourself and be honest. You know, I always talk about honesty when it comes to therapy and yourself and your mental health. If you're truly honest and you say to yourself, I find myself every day isolating and laying on my couch. I have had numerous surgeries. I don't know why I'm having all of these difficulties and these issues. I'm concerned. So one thing that I will say to especially your friend, Mark, is that he's here. He's alive. He got through the surgeries and he's here to present testimonies. He doesn't know it yet, but that is his job. And this is why he's on the other side. So God knows best. When we think that we have the answers, we don't always have the answers, but therapy would help him with that. A therapist will actually get him to see that he can look at those surgeries and understand that he is here because he's here for a reason. If we were done, if he was done in this life, he would be done, but he is not. So also, what is he grieving? So at the same time, he can talk about what is he grieving. He could be grieving that he felt normal one time in his life. Now he does not. So those are the things that he can address in therapy. The grieving and the depression usually go together. They are married to each other, depending on the person, what they've gone through, and the things that they're trying to seek for healing. Just finding enjoyment in things. He has to realize, what is my enjoyment? What did I like to do prior to these surgeries? Kind of stepping backwards to see what can re-motivate him back into the things he enjoyed doing. Yes, it can be quite depressing when you think about every time I go to the doctor, they're telling me that I might need another surgery. So that can be quite difficult because you have to process that. You have to digest that. You also have to realize your hands is in the life of your life is in the hands of someone else, which is a physician. So I would just say on my professional recommendation is that finding a therapist that he can work with, identify with, that would be, even if it's a Black therapist, find these therapists. Yes, we are hard to find, but he can find that person, identify with them, or find someone that he can actually sit down and talk to. And that's just for anyone that's listening today. If you are going through that and you've been a person that's had or experienced surgery from 1 to 20 to 1 to 50, just know that you are here for a reason. You have a story to tell, and use that as your power and your motivation. But again, identify what you think is depressing you, what your losses are, and then, seek the help. Journal in the meanwhile. So that would be journal any part of your feelings. I hate what happened to me. I don't know why I had these surgeries. How come it's me? It's okay to journal that. It's okay to say you hate it. It's okay. Write it down, get it off of you. What I usually use, the words that I use is purge, get it off of you. Put it in a journal. Scream if you have to. Scream, holler, yell, whatever it is. Punch a pillow. There are ways that you can take that energy that seems to have you so somber. You can try to get it off of you the best way you know how. No one is perfect. All I can tell him is take your time with this, and if he finds himself spiraling more and more, he really needs to seek help. Mark, it's hard sometimes to help our friends and family to get the help because they don't hear us, but they don't see what we see. So you may also see something that he's not recognizing, and it may take you to have that hard conversation with him as well. But you can always tell him, you don't have to seek therapy, but I would suggest maybe you write this sucker down, or maybe you can talk to me about it if you feel that you can, or someone that's close to you. Giving him that opportunity to take that feeling of depression and take it off of him, getting it off, because it becomes a dark cloud, and sometimes that cloud is hard to release. And he needs to try to release it and bring that sunshine back in. And that's what I'm talking about. What his motivation is, and getting him back to what he endures and love and admire, all of those things. So that's short and sweet with the both together, because I didn't want to take both of those and split them apart, but I wanted to give feedback on that, definitely before the end of our show. But does that answer your question, Mark?
Yeah, does it answer, Mark? Because she said everything, but I wanted her to answer based on her level of expertise.
No,
because
he definitely answered a lot of the questions and everything like that. Because one of the things that that particular friend said that they were getting ready to do, which I think is a big time mistake, is that they were going to give up on kind of their passion and the things that they were interested in. And I know that they had already kind of given up on their kids, because they have young kids, like teenagers and stuff like that, and maybe even a young adult. I think one of them may be in their 20s and everything. But that whole notion of giving up on anything, particularly something that you are passionate about, I think is a serious mistake that we sometimes make in our health journeys and all along those lines and everything like that. So that was a serious warning sign that I saw and everything like that. And the other thing that you said, that I think they are definitely involved in, like candle therapy and other kinds of therapies and all along those lines. But I do think that part of the health journey that we forget is that I think we get confused with religious and spiritual. And I consider myself more spiritual than religious, because I'd be lying if I said that I went to church regularly. I mean, there's a church that meets here at HI Sunday, and I might hear a little bit of their sermon. And I used to hear, when it was a bigger church that was actually in the sanctuary, or the old sanctuary, I should say, because it's our performance space now and everything like that, I would hear more of their not the entirety, but more of their sermon than I do of the current one and everything. But whether I pick up a religious book or whether I have a conversation with God on my own and everything like that, I think that a lot of times spiritual is more important than religious, because I think that sometimes we get caught up in the church walls and everything like that. So definitely a big
Right.
of the
Yeah.
spiritual aspect and not so much the religious aspect, because sometimes those church walls and church folks, not knocking church people, I've got some minister friends and everything like that, but sometimes I think we get too caught up in not trying to have that direct connection. Because to me, and I think you ladies would agree, there are four aspects of our health. It is our physical health, which we all try to do something about, our mental health, our emotional health, and I would
Mhm.
argue our spiritual health and everything. So I
Yes.
think that those are the four
Yeah.
cores of our health that we need to make sure that are being addressed and everything. And that doesn't mean that you've got to pick up the Bible or pick up the Quran, but you do need to have some sort of spiritual connection, whatever that is. It might even be connection to the ancestors and all along those lines. But I do think that you got to have some sort of spiritual backing and some sort of spiritual tie in your life.
Yeah, and I'm gonna
Agreed.
just say that the piggyback on all of this, just being a person who is provides a service, and as you said, when you think about the biopsychosocial, that's what you think: our mind, our
Mhm.
body, our social, and basically, when we did in a substance abuse, spirituality is the glue. And one
Right,
of the things that we use is the 12-step model.
right.
My life has become unmanageable. So what we had to do, because there were people say, well, I don't have a higher power. So at that time when I was doing direct service, basically the spirituality is your glue. It don't have to be a higher power. It could be your family, it could be
Mhm.
your child, whatever you're using as the glue to allow you to go through the stages of change. And that's
Right.
just one of the things, self-help. That's what it is.
Mhm.
So for me, it was hard because I'm giving the advice, but I wasn't taking the advice. So that's important. And the other thing you have to look at from the male perspective, the machismo, men feel that they have to be strong. So
Mhm.
just me providing group therapy, you have a different thing. And I actually work with women directly. One of the things that I had to learn is that women are open, men may not be.
Right.
So what happens is they'll come in, they have this exterior that I have to be this. But when you're going through health stuff and you're going through things, it will break you down. And as Dr. Diamond said, journaling, that's what you do in your private time.
Right.
And another thing, as far as being spiritual, you have to think when you go to a church, you're just getting fed, but the principles is the spirituality. That's how
Mhm.
I look at it.
Right.
Spirituality is what brings you through, it's the glue. So maybe you have to use that thing. And what happens is when you have your relationship with your higher power, because we had people who were Jewish, Christians, Pentecostals, Catholics. I said, but you all believe in one,
Mhm.
unos. So that's the thing that we have to focus on and understand that when you're going through that journey, your testimony is how did you get through that? The journaling is what you were feeling when you were at your weakest state. So I had to sit back and say, I'm providing this advice, but I'm not following it all. Once I gave it all up, I journaled. Of course, that's something that I did. But now I look back and where I got through all of that. So, Mark, that's one of the things that I know for men. They feel that they have to take it all. But that's when you have your partner, a friend, or whomever that you're going to use to get you through that process. And when you say pre-contemplation through the stages of change, I don't have an issue. Then contemplation means that you're agreeing and whatever. And I look at and I put that in every part of your life. When you have something going on, you don't want to address it. But then as you get through and you're open to that, then you have the action phase. I'm doing something about it. Maintenance means that, you know what? I'm working on it. So if you apply that to every aspect of your life, then that's a universal concept. You know what? I don't like this with the job. I don't like the job, or I'm going through something, apply that. Pre-contemplation with anything, I'm not ready. Therapy can help you get ready. Some people don't want to do it. Some people use the spiritual, the church, or whatever you're doing that's going to give you there. Now I'm ready to do the action and do everything that I need to do. And once you notice that when you're addressing it, the maintenance stage is going to be rocky.
Yeah.
It's going to be rocky. I look at it as a roller coaster, right? Dr. Diamond, it's a roller coaster. Every day you're going to wake up and you're not going to know what you're going to be faced with. But knowing that you're aware and that you're willing to work at it, it will get better. It will. So that's just something. I know that's another topic that we can go, but I just know for me being on the other side, and now that I can look back and journal what I wrote when I was in the thick of it, all those surgeries, wow,
Mhm.
I
Mm.
did it. I did
Yeah.
Yeah.
it. And I'm still working at it. I said, okay. Thank you. What you got next? I got to take my medications, because if I don't take my medications, I'm going to go back to where I was. If I'm not going to do the therapy, I'm not going to get back, so that's really what it is. Everyone's situation is individualized. Once you start, then you'll see. Just start. We're going to just start with starting to address it.
Yeah.
All right. Well, Mark, you got anything else for us before we end our show today? Any other questions?
I think that was it. I think that was it. I think I covered it, at least for now.
All right.
Everything.
This was good. This is very good discussion. We'll definitely catch up with Douglas Curry another time, because I know he did say he had another event going on also, so we totally understand that. Anyway, I think our discussion today was very good about health and the importance of health, and making sure that we follow up and do what we're supposed to do to take care of ourselves. Honestly, we actually had almost everyone had some parting words, but I'm going to give you your last moments of your parting words today. So Toya, I'm going to start with you this time, and then Mark, and then myself. So what would you say to those that have joined us on the couch and those that are going to join us later on the couch? What are your parting words for today when we think about uncovering the truth about health equities and, just awareness?
Just know that you're a person of color. If you are, you're going to be faced with different things. Do not retreat. Stay the course. If you're unaware, seek resources so that someone can help you. Because right now, in the world that we're in, if they're going to tax us on this insurance that we don't have it, then it's there. You just got to uncover where you're approved at. Okay? So you may have lost a job. I know that COBRA insurance is expensive. Go to the affordable health care so that you can address those things. Advocacy is important. 211 in New Jersey. If you can click on 211 on your phone or go into the internet, 211, it has a lot of resources which will address health. If you're having issues with food, resources, 211. The other thing that I would say for folks is that if you are having an issue at home, make sure you have your over-the-counters in your home. As far as anti-inflammatory, coughs, syrups, things like that. The Dollar Tree, even though it's $1.25, but it's taxed. But you don't always have to find Benadryl. If you don't have the money, folks say they don't have the insurance. There was someone that I was working with on the job, and they gave them a prescription. The person said, I got Medicaid. I said, okay. I said, but right now things are changing with Trump in office. They don't want to write those prescriptions for things that we can buy over the counter. So that means that don't be dismayed. Or you may have to go to another agency. Can I have a gift card to Rite Aid or somewhere, CVS, so that I can get those items? But just letting you know that the world has changed with our leadership. What used to be free is not free anymore. They want you to buy those things. But what I would say in my parting words, get those particular things at your home so that you can address a fever. So that, if you can't get to the hospital. There's other certain things, ice pack. They have them at the dollar store. Now they have the one that goes cold and hot so that you can have that hot compress or cold compress. Get your little travel kit for your over-the-counter so that you can have those things at home. And I know what I like to do for a stocking stuffer, for folks that I love, this is just an idea, give them a stocking stuffer full of those things that they wouldn't probably buy for themselves. That's it. And remember that your health is important. Ask questions. And you know what? You are a warrior. Your testimony is how you got from the beginning to the end. And that's all that I have for today.
Thank you. Mark?
I'm going to keep it real simple. It's something that my mom taught me a long time ago, but I think it's very important. And it's the one thing that we didn't discuss in this whole conversation about health equity and everything like that. And that's the notion that if you are a patient, be an advocate for yourself. Because I remember one time when mom was in the hospital, and all along those lines, she had to take a moment to talk to the nurse and basically tell the nurse that that particular food that she was being offered was not something that would be good for her in terms of her own diet and her own health, and all along those lines. And actually the nurse and the doctor thought that it was a good job of her being a patient advocate, because I think there was something that if she had actually gotten that particular medicine and that particular food in that combination, it could have been somewhat detrimental. I'm not saying it would have been life-threatening, but it could have been definitely detrimental in terms of the way that the food and the medicine would have reacted to each other and everything like that. So she was taking that moment to be an advocate for herself. And I think that sometimes we as patients are not good enough advocates for ourselves. We know our body, we know what is good for our body, we know what we can and can't take and everything like that. So definitely listen to the doctor's advice. But if you know that you are, for example, allergic to something, if you know you're allergic to milk or you're allergic to peanuts or something like that, let the doctor and the nurses know that, and let them know that if that particular medicine has that ingredients in that you cannot take that and that they need to find an alternative. So I would just urge us all to be our own advocates, because that's something that I sometimes think that we don't do a good enough job of, is being an advocate for ourselves. So I'll leave us on that note. Be an advocate for yourself.
Thank you for that. All right. Well, thank you too. As always, I'm going to take this last few moments before we end on the couch, but I thank you too of always being a fabulous co-host and showing up. So I will take this last moment here and have a discussion about what we talked about and close our podcast today on the couch. Again, thank you for joining us. And we talked about the uncovering the truth of health equities and the importance of having some awareness. You heard Mark talk about the advocacy. You heard Toya talk about the different ways that you can, advocate for yourself also in the health industry and what to look for. She also gave you the tips on what you can keep in your home, because it's necessary when you do need some kind of over-the-counter medication that can help you through. I agree with them both. We talked a lot about today health. Why is it important to put your health first? Why do you take care of yourself? Physical, emotional, also social and spiritual health. All of those are very important. And mental health. Your mental health is also one of those that we have to have that's intact. So when your mind is good, your body would follow as well. We have to remember our mind is our computers. If our mind is not right, our body will follow. I know Mark talked about a little bit, had a question about depression, and I answered that question, but you can always reach out to us via email, or also you can go on the couch on Facebook, and you can also send your question there about any questions that you have related to the mental health world, because that is where my expertise is, other than the things that I normally do on an everyday basis. So what I can tell you is put your health first. Remember that you only get one body, you get one life. But while you're here, take care of yourself. And of course, I always say take care of yourself so you can take care of others if you have to. Peace, love, and tranquility. Thank you so much for joining us on the couch. We'll see you again in 2 weeks. And we're always looking for topics that we can talk about. And I'm hoping that we will have a guest in 2 weeks as well to bring you some advice, especially to our Black and Brown community. So again, thank you very much for joining us. We appreciate you. Have a wonderful weekend, the rest of it. Be safe and take care of yourself and take care of each other. Take care, everyone. Bye-bye.
Thanks so much for tuning in to another episode of On the Couch. I hope you enjoyed today's conversation and found it as enlightening and inspiring as I did. Remember, the stories and experiences we share here are just the beginning of a much larger journey. Don't forget to subscribe on YouTube, look for the notification on Facebook, and find us on your favorite podcast platform. Your support helps us keep the conversation going and reach more listeners just like you. Until next time, stay curious, stay kind, and keep the dialogue alive. Peace, love, and tranquility. Take care, and we'll see you on the couch.